I'll jump into who we are in a minute, but many know we never went home. We were always deemed essential and in the front line, responding to very complicated social and economic needs of individuals and households, especially the most vulnerable. And this is kind of my first foray of attempting to try and give you about a 15-minute buffet, if you will, of the landscape of the impact to again, people from all walks of life, and attempt to at least just leave some thoughts, where do we go from here and what lies ahead. I have a lot more questions than answers, and I think we all agree, the nature of a global pandemic. So I appreciate, and I'm trying to walk and chew bubble gum and share my screen. Here we go. Okay, so again, thank you again. Thanks for the opportunity, and hopefully can continue to spur some thoughts for some deeper dives over the work ahead beyond this morning's presentation. Again, team, we're a not-for-profit helping human services organization. Our mission is to strengthen our community by educating, supporting, and empowering individuals and families. And as Deb said, our commitment is to the economically disadvantaged and most vulnerable populations. This is a quick snapshot of our direct programs and services. I'm not going to go through every one of these. I want to respect your time. I grabbed some of these areas to give you some anecdotals, because there's no shortage of people sending out surveys, probably to you and many others, as far as what has COVID-19 done to people who access your businesses or your programs. And it's still kind of a very gray area. But again, I think I can help share some anecdotals as well as some data behind the madness, especially the March, April, May, June time period, what we're still experiencing. And as I said earlier, things to think about in the work ahead. But again, if in its simplicity, think about basic needs, but also eliminating and eradicating barriers both within a household, but as well as within systems and communities, so that people can get on a path to self-sufficiency, so that they don't need team services over time. And again, we're not only a not-for-profit, not a 501c3, but what's really unique about Team, I often say we're not just another not-for-profit. There's amazing non-for-profits in our valley. They're exceptional, and there's many throughout the state. But part of the unique nature of Team is we're codified in state and federal law as the designated anti-poverty agency. And so with that comes exceptional responsibility, as well as extremely heightened scrutiny and accountability. And again, even our board of directors is codified and very unique in that we have people who are appointed. We have a third of our board that's appointed by elected officials in the regions that Team serves. We have people from major private interests, so people with expertise in social human services, health, business, legal, lawyers. And then what is really awesome and really cool is we have low income representation on our board of directors. At least a third of our board has that. And so how I simplify that is those most affected by the issues, those most affected by the problems, have a seat at the table and are part of that governance and part of oversight and decision making, because we can very quickly lose the sense of where the rubber hits the road as we sit around a table and talk about solutions when those most affected by the problems are not actually at the table. And so we're really proud of that. And of course, there are other agencies like Team across the state. Again, this is Team's community footprint. So we cover 12 communities. Some of our distinctions are different within each of the communities, as far as 10 of the communities were anti-poverty. Other communities have looked to us to provide 2-generational early childhood Head Start services. Specific communities where we focus and partner with the Area Agency on Aging, for example, around elderly services. And then, of course, how we're able to respond to people experiencing homelessness or looking to find safe, affordable housing, and then food assistance and other basic needs. But that is our community footprint here in Connecticut. And then, of course, as you heard Deb say earlier, you can see the number of individuals and the number of households that we served in the last year alone. And we tend to tick around here 11 to 12,000 per year. And then I also wanted to highlight, we collect a lot of data and a lot of demographic data, but I thought I'd put on here to stay within 15 minutes. I just thought I would share with you where they fall within total household income. And the 200, so you see the 55% are at or below the federal poverty level. Another 31% are at or below 200% of the federal poverty level. And the reason that's important to look at is that's what the state of Connecticut considers low income, the self-sufficiency standard. And then the remaining 14% that turn to TEAM and that TEAM helps and connect with are above 200% of the federal poverty level. Again, I think I'm singing to the choir. Bill had asked me to briefly touch on social determinants of health. This is a really good infographic that TEAM and Griffin Health and many others have utilized to help kind of give the elevator version. But again, you can look, the desperate reality is you can look at one zip code, you can look at one social, economic, environmental background and foresee the increased likelihood of poorer health outcomes, limited, less access to healthcare. And that's the desperate reality of that. And as healthcare entities like Griffin Health Services and all of you, the more we can connect with human social services entities like TEAM and many others, BH Care and many others throughout the region, we can really begin to move the needle at a population level when we talk about overall health and wellness for individuals and families. And again, when you look at the research and the data, 80% of the health outcomes are driven by the physical environment, social determinants, and behavioral factors. Sorry, an echo started. So this is a really good infographic to remind us what's at stake here. I'm actually inspired by that in the idea that, demographic is not destiny, and that, when you think about the innovations that have occurred between community-based organizations like a TEAM with businesses committed to health and well-being and of course hospitals and the gem of our valley, Griffin Health Services. The innovations, we're really seeing measurable outcomes, and these are multi-year endeavors. I'm actually inspired of identifying with clarity the problem and how we really have to change the way we do business in that intersection of social and economic well-being to that of health and wellness. And again, very quickly, I won't read each of these to you, but I just give you kind of a snapshot when you talk about, individuals and families and finding themselves in very difficult circumstances. Again, TEAM is the regional safety net. You see those thousands of individuals and households. Very often we get referrals from other nonprofits. We get many referrals from the hospitals and healthcare entities. We get many referrals from city halls, community centers, people, impacted within maybe one or multiple basic need issues, access to food, instability with housing, transportation, employment, unemployment. And what you can see here is that TEAM takes a very prescriptive approach around a universal intake. We do a comprehensive assessment. What that really means is, so when somebody comes in, somebody gets referred to us from City Hall and they're struggling with access to food, we don't just look at the food issue and help them, see if they're eligible for SNAP, food stamps, and then send them off on their way. We actually look at that may be the tip of the iceberg. And common sense can dictate that if for the food example, if one is struggling with food, common sense can dictate there might be other complexities within there. So we administer a universal intake and assessment, and then we're able to determine other areas where there might be vulnerability. They may be in crisis. They may be thriving in other areas, really looking at their strengths, and then putting together a plan with the individual at the household. And I can't emphasize more that there's both an art and a science to this work. Progress moves at the speed of trust. Individuals and people, they don't want to come into a place where they feel like they're, judgments being cast upon them, or, they're being robotically, forgive me if I say, you know, I think of the days, you know, waiting in line at a DMV and then I get into the cubicle and I get processed and go out the door. You don't want that feeling. You really, there's an art and science of the human experience. And on the bottom slide here, you see some of our core commitments at Team. We have many, you know, certified in community health worker training, case management training, service plans, family development credential. And some of these are state level, national level certifications, but these are really important. Your people, you know, are the most important asset for a helping human services organization. And I'll get more. And then the last thing I'll add here is that, you know, I ran out of space here on this page, but you really got to listen to those, you know, affected by the issues, as I said earlier, and you really need to understand what are the trends and the needs within the community that the residents who turn to you, where they live and where they work, really understanding what are the local needs. And the way to find that out is talking to those most affected by those issues. So we also are very intentional and deliberate, and not only looking at community level studies and working with our public and private partners, but we actually talk to the customers who turn to Team. We not only ask them about their, you know, getting what was their satisfaction with their experience at Team, we also ask questions about what are some of the needs or things bearing down upon you that you would be willing to share with us, you know, as we, and that really helps, in my opinion, Team with real clarity understand some of the relevant issues that are bearing down on people through no fault of their own, people who don't, thank you. Jillian's giving me a warning on time 10 minutes ago. So, and then, you know, for most part, people don't wake up and say, I want to be poor today. There's a lot of challenges and disadvantages and so forth. And so we help advocate that based on that feedback. I'm going to briefly go to this next slide is a very, very oversimplified, some of the headliners from the Valley Community Index report, which was unveiled just months before the pandemic, you know, came crashing upon Connecticut, came crashing upon the Valley region. It was unveiled at Sinto Towers in Shelton in October 2019. It looked at multi-year data and information. It was put together with the Valley Community Foundation, Data Haven, Griffin Health, many nonprofits and for-profits from the Greater Valley Chamber, as well as the Valley Council for Health and Human Services. So if you haven't seen it, I really encourage you to go to that and look at that report. It's very, there's a full report and there's an executive summary. But for the purpose of today, I just want to kind of stick with 5 headliners here from that report that you can kind of walk away with. The poverty rate in the Valley has increased. The low income rate in the Valley has increased. The median household income has declined. 36% of the region's households are housing cost burdened. 15% are severely cost burdened. Cost burden means they are spending more than 30% of their household income towards the roof over their head. Severely means more than 50% of the resources are going towards the roof over their head. And when you look at renters and the rental units, 1 in 4 are severely cost burdened. 1 out of every 4 in this very region we live and work in. And then you can, when you connect the dots with the income levels, you know, more than 50% of the total income, the median household income for rental households was $6,500 less than what is needed to afford the median rent in this very region for a 2-bedroom housing unit. And then lastly, 43% of the region is below the ALICE threshold, asset limited, income constrained, employed. Many will look at this, we'll call that, another way they look at that is the working poor. This is a comprehensive United Way study that not only looks at income, but it looks at the actual costs of the essential needs. So when you think of the actual cost for housing in the Valley, the actual cost for food, the actual cost for transportation, the cost here for childcare if you have young children, school age opportunities if you have older kids, it looks at those actual costs and the income. And 43% of the region, what this means, a significant portion of the Valley region that doesn't fall under the federal poverty level, nor does it fall under the low income state self-sufficiency level, but is still struggling to meet their basic needs for themselves and or their families within their household. And before I move off this slide, this is, I just want to reiterate, this was in October 2019 that this report was unveiled. This is before any cognizance of a pandemic and the devastating impacts of what COVID-19 brought upon the community. Now what I'm going to quickly do is I'm going to hit some images here, and I got to get that speaker out of my way here. Again, I showed you earlier in the slides the array of some of the programs and services at Team. I decided to pull a couple just to give you some anecdotal, because people have said, you know, what's the information? What has been the impact? So when you think about Many Know Team for Meals on Wheels, and you know, on the left side here, you can see pre-pandemic. You know, we have Meals on Wheels trucks that go throughout the Valley communities: Ansonia, Derby, Oxford, Seymour, Shelton, door to door, providing a nutritious meal as well as providing that daily connection. Many Know Team for those connections having resulted in saving lives and getting frail elderly connected immediately based on needs. It's not only that meal, but also that daily connection. And on the right side, you can see some of the images of what COVID-19 brought as far as some of the immediate modifications and interventions that we had to do. And as you all know fully well, when you look at, you know, immunocompromised populations, age over 60, age over 65, this was a very, you know, 1 in 3 of our Meals on Wheels customers were aged over 90, 100% of them were aged over 60. We had to immediately, and you saw senior centers closing. We had congregate meal programs going on that had to close for seniors that were mobile and could come together. Those were closing. So we saw an immediate increase, and as we saw seniors needing to shelter in place and reduce their footprint in the community, rightly and obviously so, we saw an immediate increase in number of seniors that we had to serve, you know, within 2 weeks, you know, from March 15th going into April by 21%. And we more than doubled the meal output. So we not only significantly added more seniors, we went over 200 seniors each day that were receiving a meal. We doubled the meal. So they were getting a fresh meal and a shelf-stable meal every day, Monday through Friday. And so this is anecdotally an example of some of the surge and what the response had to be. I could dive really deep on some other areas, but I want to respect the time. I want to emphasize elderly well-being and, you know, the volunteer caregivers and reassurance. We immediately mobilized. We had a lot of homemaking services, home visits going on. We had volunteer caregivers doing, you know, light landscaping, house cleaning, light laundry. We had to very immediately change many of those and cease a lot of those, but there were some very, you know, high need, critical circumstances where we needed to make sure connections were going to continue and be made. So we were able to mobilize an enormous amount of volunteers, especially, you know, the desperate reality that many lost, you know, people were no longer working and staying home, and people want to know how could they help. And so we were able to, some of our examples, we were able to create these large databases of volunteers who would do telephone reassurance checks with seniors throughout the pandemic, and even creative aspects of doing porch drops, of getting, you know, picking up prescription medications and medical transportation rides, excuse me. But I'm going to skip all that in the interest of time. But the key was just mobilizing and being responsive. And again, you all know this in many ways. I'm singing to the choir here based on the audience. Another aspect I'm going to touch on is the diaper bank. Many know Team for its regional diaper bank. It's caught national and state attention over the years. These images are all pre-pandemic, you know, and you know, if I connect the dots, what I said earlier about, you know, the art and science of case management and progress moving at the speed of trust, I'll share with you anecdotally the month, you know, we see over 200 families that would come to our diaper bank each month to access diapers for their newborn and young children up to age 4, or other children with special needs. But you know, it's not a good feeling. It's not, you know, unless you walk it, it's hard to describe it. But going somewhere to depend on others or to get something, so walking into a diaper bank or walking into a food pantry, you know, your feeling of dignity, and there's a lot of, you know, you in many ways you want to go in and you want to feel, you want to be invisible, you want to get the relief, and you want to get out of there, and you want to pretend no one saw and you weren't there. And my point of describing that is, to be very succinct here, I'm trying to be, is a Valley mother who learned about the diaper bank. We got a referral from her. She came, got her diapers, went out the door. Came month 2, got her diapers, went out the door. Came the 3rd month, started to connect and speak with our care workers and our care management staff. Um, Long story short, she opened up that she had dropped out of school in Shelton years ago. And long story short, she went back to Valley Regional Adult Ed, got her GED, and went onto a path towards improved well-being. And so my whole point of that very quick, cheating all the details of that story, is that it's more than just the relief. It's more than the diaper. It's more than the food. It's about the connection and the case management connection and moving at that speed, and then knowing when to get out of individuals' way so that they can succeed and thrive. And so and that's why you see examples of families coming together, sharing around the joys and trials and tribulations of parenting. Your 2-year-old does that too. Mine does. I thought that my kid, there was something wrong. That's normal child development, et cetera, et cetera. And then the gateway to the other, social and economic experiences that as we move towards on a road to self-sufficiency. And I'm not going to read all this, but you can see some of the data here as far as, the science and the research is clear on diaper need. The Yale study that caught national attention, published across the country, that, connected diaper need to maternal health and depression, the clear health implications for the lack of adequate diaper supply for young children. And the partnership, entities like, we talked about Griffin Health earlier, they get this, you get this. Again, I'm intimidated by presenting to healthcare professionals. So you understand, how deep these connections are. And we think about families who leave the child birthing unit and wondering who's going to, especially under-resourced households, and who's staying connected with them. The diaper bank has been a really powerful connection to young children and their families, and especially hard to reach families and vulnerable families that are in difficult circumstances. And from a COVID-19 lens, in the top left here, we average about 28,000 diapers over a 3-month period. We're averaging a distribution of about 115,000 diapers each year for Teams Diaper Bank, and that's prior to COVID, helping about 280 families each year, and staying connected with them each month. Lower right here, you look at the COVID-19 experience through these 3 months of April, May, and June. The amount of diapers we distributed increased exponentially. And so it just kind of gives anecdotally and from a data perspective, a staggering, my goodness, on what was happening very quickly and very scarily when I don't think I'm overstating this, when the world began to shut down very quickly from every angle upon people, and how that just further exacerbated the already vulnerable needs for individuals and families. And I'm getting close here. I'm going to gloss over food hardship. Again, we, in our Valley community, team does a lot of food assistance directly with elderly and seniors, as well as young children. We do a lot of SNAP outreach and food stamp assistance. And we also do a lot of referrals to food pantries in our Valley region. There's 5 key food pantries in our Valley region. And at the top here, you can see the level of distribution and the level of need going on right here in our Valley communities. Again, there's 2 pantries in Ansonia, 1 in Derby, 1 in Seymour, serving both Seymour and Oxford, and there's 1 in Shelton. All 5 of them are very tightly knit. They're independent, autonomous nonprofits, but we have a very strong network on how we're trying to, coordinate our care management, do effective referrals in addressing food insecurity. And so you can see here the amount of food. When you see pounds of food, pounds is a universal metric used for food pantries and End Hunger and Connecticut Food Bank and Food Share. And what that equates to, on a pound for pound basis, based on the foods, that's about 53,000 meals distributed. And guys, this is per month. And this is just under 2,000 individuals in our Valley, 30% of which are children, 15% of those, about a little over 300, are older adults age 60 or more that are accessing those food pantries. And then another data element I would share with you is, many of you, I'm sure, are familiar with the Accountable Health Communities Grant Initiative. And when you look at the screening data they presented at the last regional presentation. And again, this is covering not only the Valley regions, going into Danbury, New Milford, and beyond. When you look at the screening data, when they did, and again, this is the social determinants of health screening, so patients going into healthcare entities and the screening getting conducted for social needs, and then getting referred to other community-based organizations like a food pantry, like a team, and like many others. They conducted 36,000 screenings since they started this in July 2018 through July 7, 2020. The number one need was food. The number one health-related social need was food. So they're asking all kinds of questions around housing, transportation, food, all those basic needs I talked about earlier. During the pandemic, when you look down here from March 8th, 2020 to July 7th, 2020, the food need stayed at number one, but it went up from 50% to 66%, went from 1 and 2 to 2 and 3. Food need, probably no surprise to any of you, is still the headliner as far as amidst the worst times of the COVID-19 impact, but also when we think about current navigation and response and long-term recovery, food continues to be a headliner moving forward. Childcare, these are images of Team's childcare location in Ansonia. We stayed open throughout the pandemic. We were only serving children of essential workers, more specifically Griffin Health Services. Again, this was part of a statewide initiative. You know, caregivers can't help sick people and help save lives if their children are not watched over, as we all know. And you think about first responders, et cetera, et cetera. And so these are some of the images of Team's childcare program operating throughout the entire pandemic. And of course the guidance, very complicated guidance, and we're really proud of how well we were able to do it and how well we were able to support healthcare workers throughout the pandemic. I'm going to skip this page. This is around comprehensive case management and support services, but I'm going to go back to it. You can see individuals helping, you know, one of the most powerful social, you know, programs is living wage job, increasing one's wage. So we have a lot of focus around employability, training and education, individuals who are working towards housing and securing safe and affordable housing and getting out of dire situations. And I'll circle back to that. And so my last page here is when I think about, you know, I wrote response and recovery and response, recovery. You know, I'm on a number of state level and local level groups, and, you know, there is no it is not linear. It's actually quite, it's quite messy, and that's the nature of what it needs to be. And, you know, we need to be able to pivot very quickly, day to day, even moment to moment, month to month. Sometimes we're in full response, and sometimes we're moving into recovery, but sometimes we're doing both at the same time, and sometimes depending on the area we're talking about. And so I think we need to really open our minds and not think so linearly about, well, when do we do recovery? We need to think about both response and recovery simultaneously. And I recognize that that can further make it very overwhelming, but there's too much at stake on the here and now and the long-term post-pandemic, especially when you think about some of that Valley Community Index data that I shared earlier. So these are my headliners, kind of food for thought to walk away with. Again, I don't think these are any big surprises for you. Employment keeps me up at night. I think of the avoidance of, you know, it has to be all about the avoidance of the long-term unemployment. You saw those record numbers March through May. And what does it mean for individuals who become long-term unemployed and begin to lose a lot of those supports going into December and into February 2021? Food security, you heard me speak a lot about food insecurity. I skipped, you know, Team was a site for the grab and go for school age kids. So picture pre-K all the way up to 12th grade kids. Remember, when the school system shut down in the middle of March, kids not only, it's not just about the academic experience, and it's not just about the social experience with peers and mentors and adults. It's also about basic needs, especially when you look at some of the Valley Community Index, especially when you look at some of the high need areas, pockets of need within Shelton and Seymour. And most certainly when you look at the entire landscape of Ansonia and Derby, those kids from pre-K all the way up to 12th grade, that was food security for those kids. They were not only going to first grade and sophomore high school for an education and a social experience, they were actually accessing meals every day. And so when the school shut down, a significant need of food access also shut down. However, we were able to work really closely with the school systems. And again, we were a grab and go site. So families, and I'm telling you, in the first 10 minutes of our first day in March at Team, when the schools were closed, we had 30 families coming in looking for the food of their school age kids. They come in every day to Team, they would grab today's lunch and tomorrow's breakfast, and they would come every day. So food security, remember seniors, and then don't forget about young children. You know, the little guys often get kind of missed on the list when you think about formula, and you think about the level of hoarding and access or inaccess during those March and April times. So we actually had to turn the meter up, that when we were giving out diapers, we had to significantly give out more formula to young children and their families. Housing, hot off the press, there's been a moratorium. This keeps me up at night. The shutoffs, you know, they're in multiple ways, but there's been a moratorium. You know, people can't get evicted who are falling behind on their payments. And that was going to sunset August 25th. The governor just did an executive order, and now that goes into October, which is another temporary fix, but it creates all kinds of, and I'm not saying it's right or wrong, what I'm saying is it creates a lot of anticipation of this, a tsunami of social and economic need as those moratoriums come to end in October. And we have to be mindful of the landlords also, their well-being and their livelihood and their role in the economic engine and vitality of our community. So there's so many things within housing. And again, it was already a challenge pre-pandemic. And then there's moratoriums on, you know, heating assistance, yeah, the energy bills, the water bills. Some of those are sunsetting at the end of September. Some are sunsetting. They may restart as we go into the winter. And again, these are Band-Aids, though. These are things where it can't go on forever. And these individuals and households, they've got to figure out and find resources on how they're going to turn the corner so they're not in such financial anxiety and stress. And then lastly, childcare. You know, childcare, if it wasn't food and housing and the employment issue, childcare was the other one at the headline. You see childcare, people can't go, like I said earlier, people can't go to work. You know, one of the, you know, the epiphanies of this pandemic is that childcare is an essential element to the economic vitality of a working community. People, you know, childcare works so parents can go to work. So first responders and healthcare providers can get and do their job. Teachers in public school can do their job. And so unfortunately, childcare was a very frail, very underfunded, very vulnerable system pre-pandemic. And what's at stake and has already begun to happen is childcare programs that are gone forever, and there are more that will continue to be gone forever. And so that's a major problem, and it's a major component for working families to be able to go to work, who want to work. They have everything ready to go to work, but they have nowhere for their child to go. And when you look at, like, the, you know, with the phasing in, and, you know, being at some of the past chamber events and groups where you listen to the businesses say, all my workers are in except the ones who have kids because they don't have childcare, so we're still working that out. So that's a big one that we really got to strategically think about. And then lastly, this is the physical well-being, obvious, you know, the devastating loss of life and health and well-being. And then also that metaphysical, that emotional well-being. You know, how are our kids taking this in? How are you taking this in? How is our elderly parents doing, you know, sheltering in place for such an extended period of time? How are we doing, you know, as nonprofit leaders? How are we doing? How is our staff doing, who pour so much of themselves into helping others and then trying to be the best, you know, mom, dad, husband, wife, partner that they can be? How are people doing mentally? Keeps me up at night. And that whole human experience. And the idea that, you know, again, it happened so fast and furious in March. And I have vivid, I can't put numbers on this, but I have vivid recollections of people being on the phone with our care management staff and just not wanting to get off the phone. They're just, you know, things are shutting down. I'm getting hard time accessing some needs. Shelves are clearing. I can't even get through to the state. It's just nice to be able to talk to somebody, help me get to something or access something. And meanwhile, I'm watching my care management staff having those conversations, and the switchboard lights are building up and building up and building up. And so, just how do we stay connected, both with people, residents, and neighbors, but also as organizations and coalitions? Um, I'll end with this. You know, a 10-year-old on the right side, a 10-year-old was, I guess, watching some things, you know, through the weeks, and I got this in at the end of March and early April, and she wrote this note, and of course she addresses it to me because she found my name. But this is really addressed to all the volunteers and the staff in the board and everybody at team. And I commissioned her to make as many these bracelets as possible because they're very inspiring to wear. And we always want to make sure that the good is louder than the bad. I mean, I'm not going to, you know, the onslaught of media and news that it was really hard to even keep your mental faculties together. And so, you know, these are the things, and, you know, sharing messages like Mr. Rogers' message and his image and the helpers. I'm just, you know, the gratitude and the unique nature of the Valley of how many people come together. We're in this together. I'm actually, I mean, I shared a lot of bleak things, but I'm actually inspired on the doability factor and what an exemplar our region has been and can be as we navigate response and recovery. Thank you.